First of all, a very good morning to everyone. I find myself very unfortunate that I couldn't able to attend the physical conference on 11th because of visa issue. But thank you for giving me this virtual opportunity so that I could present my work. The work on which I am presenting today is comparison of cardiomyogenic potential of amniotic fluid mesenchymal stromal cells derived from normal and isolated congenital heart defective fetuses. So brief about the background. Congenital heart defective or heart disease is the most prevalent neonatal disorder affecting the 10% of the stillbirths per annum globally. And it is characterized by the mutation in the cardiac transcription factor, single nucleotide polymorphism, aneuploidy, and chromosomal copy number variants. Spectrums, that is the etiology, is involving of the defects in the valves, septum, vessels, that leads to this defect in the fetuses, and which called the isolated congenital heart defect. So basically, next slide, please. So this improper heart functioning in the CHT has put doubt on the differentiation potential of the resident cardiac progenitor and cardiac stem cells during the heart development. Next slide. So there have been few studies that shown that the defects in the cardiac morphology can arise from cardiac progenitor cells involved in the cardiac function, heart tube assembly, and neovascularization. Also, despite several advancements in the treatment, the risk of rejection, thrombosis, inflammation limited their use, and thus the heart transplantation is left as the only option. So recently, stem cell therapy has emerged as a potential treatment for CHT. Next slide. Mesenchymal stem cells are so far the most widely explored stem cells in the preclinical and clinical studies and can be obtained from both adult and fetal tissues. However, the adult-derived MSCs are limited by need of the invasive harvest, low yield, and varying self-renewal capacity between the cell donors and the frequency of MSCs. Recently, our group have shown that the fetal AFMSC have a superior cardiomyogenic potential than BMMSC. This AFMSC is amniotic fluid mesenchymal stem cells. It's derived from fetal sources. The AFMSC showed significantly elevated expression of cardiac transcription factors than that of the bone marrow derived mesenchymal stem cells, and highlighting the possible reason for higher cardiomyogenic potential in the potential of AFMSC. Next slide. Again, the slide is blurred. So amniotic fluid serves as a protective liquid for the developing of fetuses and can be collected safely during the routine amniocentesis or during the cesarean section. Amniotic fluid primarily contains the amniocytes, amniotic epithelial cells, transcripts, and these amniotic epithelial cells contain the progenitor cells or the resident cardiac stem cells that can differentiate into various organs such as heart, brain, kidney. And these resident cardiac stem cells have been studied for the expression of cardiac transcription factor of mesoderm origin, such as NKX2.5, GATA4, TBX family, which play important role in the heart development during embryogenesis. Next slide, please. So what was the rationale for this study? CHT is characterized by the improper heart development during the embryogenesis, which could possibly due to alterations in the cardiomyogenic properties of the pool of cardiac progenitor and stem cells associated with the fetal heart development. However, there is a paucity of data on cardiomyogenic characterization of cardiac progenitor and stem cells associated with the CHD fetuses. Therefore, to ascertain whether the AFMSC derived from CHD fetuses carry any defect in their cardiomyogenic potential, we have evaluated the levels of cardiomyogenic progenitor markers, cardiac transcription factors, expressed by the MSC derived from the isolated congenital heart defective fetuses, and compare it with the normal fetuses, like the structurally normal fetuses, so that we could evaluate whether there is a defect in the stem cell level itself or not. Next slide, please. And for the subjects, we opted for 7 pregnant women with the fetuses having isolated congenital heart defect, and 7 pregnant women with structurally normal fetuses with a mean age of 29. And just gestation age we chose, it's 16 to 22 weeks. In controls, women with structurally normal fetuses who underwent the routine amniocentesis for prenatal diagnosis and had no cardiac and genetic or other abnormalities were recruited as controls. The inclusion criteria was, this study included the cohort of ICHG fetuses having the major congenital heart defective defects confirmed by the fetal echocardiogram, preconceptional folic acid intake by the mothers, and similar gestation. Exclusion criteria involved the maternal CHD, the absence of the fetal anomaly except the cardiac, the mother's diabetes or previous history of the diabetes mellitus, and different gestational age. Next slide, please. So for this, we isolated, cultured, and expanded the AFMSCs up to passage 3. There we characterized and checked is the growth kinetics. Then we have evaluated the expression level of cardiac progenitor markers by flow cytometry, cardiac transcription factors by real-time PCR, and cardiovascular markers by immunocytochemistry. Next slide, please. Next slide. So the morphology of normal and ICHD FMSC. We observed normal and ICHD FMSC exhibited a uniform spindle-shaped morphologies. Next. Next slide, please. Thereafter, we characterize the AFMSC, normal and ICHD AFMSC by the flow cytometry, and we check the MSC markers, CD73, CD90, CD105, and we have observed that the normal and ICHD AFMSC exhibited the positive expression for MSC markers and negative expression for the hematopoietic stem cell markers. Next slide.